I'm about to reveal something that might shock you. That tingling in your feet, the numbness in your hands, the burning sensation that wakes you at night. It isn't just neuropathy or diabetes complications or normal aging. It's your body screaming that something is poisoning your nervous system. And the most terrifying part? Most doctors will never check for it. They'll prescribe gabapentin, tell you to manage your blood sugar better, maybe suggest some physical therapy, but they won't ask the one question that could reveal the hidden poison silently destroying your nerves from the inside out. I'm Dr. Robert Anderson, a board-certified neurologist with over 23 years specializing in peripheral neuropathy in older adults, and after 2 decades watching hundreds of seniors suffer through years of progressive nerve damage, being told it's irreversible, being handed prescriptions that mask symptoms without addressing causes, I refuse to stay silent anymore. Because what I'm about to share goes against everything you've been told about nerve pain and numbness. The medical establishment treats neuropathy as a life sentence. They manage symptoms. They rarely investigate the underlying toxic exposures that are actually killing your nerves cell by cell, day by day. This isn't fear-mongering. These are real patients I've treated, real toxic exposures I've identified, real recoveries I've witnessed when we removed the poison and gave the nervous system what it needed to heal. And if you're over 60 and experiencing any form of numbness, tingling, burning pain, or loss of sensation, what I'm about to reveal could be the difference between progressive nerve death and genuine recovery. Before we go further, I need you to do something for me. Subscribe to this channel right now. My mission is to provide straight-shooting, evidence-based information about neurological health that most doctors either don't know or won't tell you. Turn on notifications so you don't miss future videos, and drop a comment with your age and where you're watching from. I read every single comment, and I want to know this message is reaching people who truly need it. Now, let me be very clear about what we're discussing today. I'm going to reveal 5 hidden poisons, toxic exposures that are far more common than you think, that are actively destroying peripheral nerves in millions of seniors. These aren't exotic chemicals. These are substances in your home, in your diet, in medications you might be taking every single day. And the reason your doctor hasn't checked for them? Medical training doesn't emphasize environmental neurotoxins. Doctors are taught to diagnose diabetic neuropathy, B12 deficiency neuropathy, idiopathic neuropathy, but systematic investigation of toxic exposures, that's not part of standard protocol. Each of the 5 poisons I'm about to describe has a specific mechanism of nerve destruction, and each one has a specific solution, a way to identify it, eliminate it, and support nerve regeneration. By the end of this video, you'll understand exactly what to look for, what tests to request, and what steps to take starting tonight. If what you hear today resonates with you, if you recognize yourself in these patient stories, I'm asking you to share this video. Think about your parents, your spouse, your friends who've been told their neuropathy is just diabetes or just aging. A simple share could give them answers their doctors never provided. Let's begin. Hidden poison. Number 1. Fluoroquinolone antibiotics. The most common and most overlooked. Let me tell you about Margaret, 68. She came to my clinic 18 months after her neuropathy started. It had begun suddenly, burning pain in both feet, progressing to her calves, then her hands. Her primary care doctor had checked her blood sugar, normal, checked her B12, normal, ran a basic metabolic panel, everything normal. He diagnosed idiopathic peripheral neuropathy and prescribed gabapentin. The gabapentin dulled the pain slightly, but the numbness kept spreading. Margaret brought me a notebook where she'd been tracking her symptoms daily for over a year. She was desperate. "Dr. Anderson," she said, her voice tight with frustration, "I'm losing sensation in my fingertips. I dropped a glass last week because I couldn't feel it slipping. I'm scared this is going to keep spreading until I can't walk." We went methodically through her medical history. No diabetes, no alcohol abuse, no family history of neurological disease. She ate well. She exercised. She was doing everything right. Then I asked what seemed like an almost trivial question. "In the 6 months before your symptoms started, were you prescribed any antibiotics?" She paused, confused. "Yes, actually. I had a bad UTI. They gave me, I think it was called Cipro." There was the problem. Ciprofloxacin, a fluoroquinolone antibiotic. Margaret had taken a 10-day course of Cipro exactly 4 months before her neuropathy began. Here's what was happening at the cellular level, and why no one had caught it. Fluoroquinolone antibiotics like ciprofloxacin, levofloxacin, and moxifloxacin are prescribed millions of times every year for urinary tract infections, respiratory infections, and skin infections. They're incredibly effective antibiotics, but they carry a black box warning from the FDA for a reason. They can cause permanent peripheral neuropathy. The mechanism is mitochondrial toxicity. Your nerve cells, especially the long peripheral nerves running to your feet and hands, require enormous amounts of energy to function. That energy comes from mitochondria, the tiny power plants inside each cell. Fluoroquinolones damage mitochondrial DNA. They disrupt the electron transport chain. They literally poison the energy production system that keeps your nerves alive. When your peripheral nerves can't produce enough energy, they begin to die from the tips inward. That's why fluoroquinolone neuropathy starts in the feet and hands, the longest nerves, the ones that require the most energy to maintain. Research published in the Journal of Clinical Neuromuscular Disease found that fluoroquinolone-induced neuropathy can occur during treatment or up to 6 months after the antibiotic course ends. The damage can be permanent. And the terrifying part? It's dose-dependent but not predictable. Some people take one course and develop severe neuropathy. Others take multiple courses with no issues. But if you're over 60, if you have any existing mitochondrial stress, if you're on certain other medications, your risk skyrockets. And why do doctors miss this? Because the neuropathy doesn't start immediately. By the time symptoms appear weeks or months later, neither the patient nor the doctor connects it to an antibiotic they took months ago. It's not on anyone's radar. I had Margaret stop the gabapentin and start a targeted mitochondrial support protocol. Coenzyme Q10, CoQ10, 400 ml daily in the ubiquinol form, the active form that directly supports mitochondrial function alpha-lipoic acid, 600 ml daily, a powerful antioxidant that protects nerve mitochondria from oxidative damage, acetyl L-carnitine, 1500 ml daily, helps transport fatty acids into mitochondria for energy production. B complex with methylated forms. B vitamins are essential cofactors in energy metabolism. Within 3 weeks, Margaret noticed the burning pain beginning to ease. Within 6 weeks, the numbness had stopped spreading. Within 4 months, she had regained about 60% of the sensation in her fingertips. 18 months of progressive neuropathy, stabilized in 6 weeks by addressing mitochondrial poisoning and supporting nerve regeneration. I showed my primary care doctor your protocol, she told me 6 months later, genuine frustration in her voice. He said he'd never heard of fluoroquinolones causing permanent nerve damage. He didn't believe Cipro could have done this. That, I said gently, is exactly the problem. Why does this work? Because if you remove the toxic exposure and give damaged mitochondria the raw materials they need, CoQ10 for electron transport, alpha-lipoic acid for antioxidant protection, acetyl L-carnitine for energy metabolism, nerve cells can begin to repair themselves. Nerves regenerate slowly, about 1 millimeter per day, but they can regenerate if you address the underlying mitochondrial damage. Why do doctors miss this? Medical training emphasizes infectious disease and antibiotic efficacy. The focus is on killing bacteria, not on monitoring for delayed neurotoxic effects. The black box warning exists, but most doctors don't routinely counsel patients about neuropathy risk before prescribing fluoroquinolones. And when neuropathy appears months later, the connection is never made. We arrive at the second reason, hidden poison. Duratu, statin medications, the cholesterol drug. No one suspects. Let me tell you about William, 72. William had been on atorvastatin, a statin medication for high cholesterol, for 8 years. His cholesterol numbers were beautiful. His cardiologist was pleased. But about 14 months before I met him, William had started experiencing weakness in his legs. Not pain exactly, just progressive weakness. Difficulty climbing stairs, trouble getting up from a chair without using his arms. His doctor had run blood work, checked his thyroid, checked for inflammatory markers. Everything was normal. He was referred to a neurologist who did an EMG, a nerve conduction study. The results showed axonal peripheral neuropathy. The diagnosis, idiopathic. Cause unknown. William was told to come back in 6 months for repeat testing to monitor progression. Dr. Anderson, he said, exhausted, I used to hike 5 miles every weekend. Now I can barely walk around the block without my legs feeling like they're going to give out. Nobody can tell me why. I asked him to list every medication he was taking, When he said, atorvastatin 80 milligrams, I stopped him. How long have you been on that dose? They increased it about maybe 2 years ago. My cholesterol was a little high. There it was. Statins, atorvastatin, simvastatin, rosuvastatin are among the most prescribed medications in the world for managing cholesterol. They work by blocking an enzyme called HMG-CoA reductase, which your liver uses to produce cholesterol. Lower cholesterol production, lower blood cholesterol levels. Simple, right? But here's what they don't tell you. That same HMG-CoA reductase enzyme is also responsible for producing coenzyme Q10. When you block cholesterol synthesis with a statin, you simultaneously block CoQ10 synthesis. And CoQ10, as I just explained with fluoroquinolones, is absolutely critical for mitochondrial energy production in nerve cells. Long-term statin use, especially at higher doses, can deplete CoQ10 to the point where peripheral nerves don't have enough energy to function. The longest nerves are affected first, the legs, the feet. You get progressive weakness, sometimes pain, sometimes numbness. A study published in the Journal of Clinical Neuromuscular Disease found that statin-induced peripheral neuropathy occurs in approximately 4 to 14% of long-term statin users, with risk increasing significantly at higher doses and in patients over 65. The neuropathy is often misdiagnosed as idiopathic or age-related because doctors don't routinely consider medication-induced mitochondrial dysfunction. And here's the cruelest part. The neuropathy can continue to progress even after you stop the statin if you don't actively restore CoQ10 levels. I had William work with his cardiologist to reduce his statin dose to the lowest effective level. Some patients can stop statins entirely and manage cholesterol through diet and exercise, but William had significant cardiovascular risk factors, so we kept him on a lower dose. Then we started aggressive CoQ10 supplementation, CoQ10, ubiquinol form, 300 ml daily. Vitamin E, 400 IU daily, enhances CoQ10 absorption and provides additional antioxidant support. Magnesium glycinate, 400 mg daily, essential for nerve function and energy metabolism. The first month, William noticed his leg fatigue improving slightly. The second month, he could climb stairs without needing the handrail. The third month, he went on a 2-mile hike. 8 months later, he told me, I honestly thought you were a little crazy when you said my cholesterol medication was causing my leg weakness. But I can't argue with my legs. The strength came back. Why does this happen? Because mitochondria in nerve cells are incredibly energy demanding. When you deplete CoQ10 through chronic statin use, you're starving those mitochondria of a critical component they need for ATP production, the energy currency of cells. No ATP, no nerve function. Why don't doctors check for this? Because statin side effects are typically framed as muscle pain, myopathy, or liver enzyme elevation. Peripheral neuropathy as a statin side effect is mentioned in medical literature, but it's not emphasized in clinical practice. Doctors don't routinely monitor CoQ10 levels. They don't routinely recommend CoQ10 supplementation with statin therapy. And when a patient on statins develops neuropathy, it's labeled idiopathic rather than drug-induced. Before we continue with the next 3 poisons, I want to make a quick request. If what you've heard so far seems valuable, if you're recognizing yourself or someone you love in these stories, I'm asking for 2 simple things. First, subscribe to this channel if you haven't already. My mission is to provide clear, straight-shooting neurological health information that the medical system often overlooks. Second, and perhaps more important, share this video. Think about your parents, your spouse, your friends who are struggling with unexplained neuropathy, being told it's just diabetes or just aging or just bad luck. A simple click can start a conversation that could genuinely give them answers their doctors never provided. Thank you for your support. Let's continue with the 3rd hidden poison. Hidden poison. Number 3. Chronic low-level lead exposure. And this one will absolutely surprise you. Let me tell you about Dorothy, 74. Dorothy had been experiencing progressively worsening neuropathy for about 3 years. Burning pain in her feet, numbness in her hands, fatigue, muscle weakness. She'd been through the standard workup, HbA1c normal, B12 normal, thyroid normal. EMG showed peripheral neuropathy, but no clear cause. Her neurologist had diagnosed small fiber neuropathy and prescribed duloxetine, a medication for neuropathic pain. It helped somewhat, but the progression continued. Dr. Anderson, she said, tears in her eyes, I can barely feel my feet anymore. I'm terrified I'm going to fall. I don't understand why this keeps getting worse. We went through her full history. No obvious toxic exposures, no alcohol, no diabetes, no clear explanation. Then, almost as an afterthought, I asked her about her home. How old is your house? Oh, it's quite old. We bought it 30 years ago. It was built in 1948. Have you done any renovations recently? Actually, yes. We've been slowly remodeling. We stripped the old paint in the living room and dining room about 4 years ago. We did most of the work ourselves to save money. There was the problem: lead poisoning. Houses built before 1978 in the United States almost universally contain lead-based paint. When you disturb that paint, sanding, scraping, demolition, you release lead dust into the air and onto surfaces. You inhale it. You ingest it from contaminated hands and surfaces, and lead is a potent neurotoxin. Lead interferes with nerve function through multiple mechanisms. It disrupts calcium signaling. Nerves rely on precise calcium regulation for electrical transmission. It damages myelin, the protective coating around nerves that allows for fast signal conduction. It causes oxidative stress and mitochondrial dysfunction, and it accumulates in bones and soft tissues, causing chronic low-level exposure that can last for years even after the initial exposure ends. Chronic lead poisoning presents as peripheral neuropathy, especially motor neuropathy with weakness, along with fatigue, cognitive issues, abdominal pain, and anemia. But most doctors never check for it because they don't think to ask about environmental exposures in older adults. I ordered a blood lead level for Dorothy. It came back at 18 micrograms per deciliter. For context, the CDC considers any level above 5 mcg/dl to be elevated in adults. Dorothy had nearly 4 times that level. She had been chronically poisoned for years from lead dust in her home. We immediately referred her for chelation therapy, a medical treatment that uses specific compounds to bind lead and remove it from the body. For milder cases, we can use oral chelators. For more severe cases like Dorothy's, IV chelation is more effective. Simultaneously, we started alpha-lipoic acid, 600 ml daily, helps remove heavy metals and protects nerves from oxidative damage. N-acetylcysteine, NAC, 1200 ml daily, supports glutathione production, the body's master antioxidant and detoxifier. Vitamin C, 1000 ml daily, helps increase lead excretion. Calcium and magnesium. These minerals compete with lead for absorption and can help displace it from tissues. We also had her home professionally tested and remediated. Lead dust was throughout the house. Professional abatement was necessary. Within 2 months of starting chelation and the supplement protocol, Dorothy's blood lead level had dropped to 8 mcg/dl. Within 4 months, it was down to 6. Within 6 months, her neuropathy symptoms had stopped progressing. The burning pain decreased significantly. Some sensation began returning to her feet, not completely, but noticeably. I never would have guessed lead poisoning, she told me, shaking her head. I thought lead poisoning was something that only happened to children. She's not alone in that misconception. Research from Johns Hopkins University found that chronic low-level lead exposure in adults is vastly underdiagnosed and is a significant cause of peripheral neuropathy in people over 60, especially those living in older homes or with occupational exposures. Why does this work? Because once you remove the lead through chelation and by eliminating the source, and support the body's natural detoxification pathways with antioxidants and glutathione precursors, nerve cells can begin to recover from the oxidative damage and mitochondrial dysfunction. The damage isn't always fully reversible if exposure was prolonged, but progression can be stopped and partial recovery is often possible. Why do doctors miss this? Because environmental history isn't routinely taken in neurology appointments. Questions about home age, renovations, hobbies, occupational exposures, these aren't part of standard neuropathy workup protocols. Blood lead levels aren't routinely checked unless there's obvious exposure history. And chronic low-level lead poisoning presents as nonspecific symptoms, fatigue, neuropathy, mild cognitive issues that are often attributed to aging. Hidden poison number 4. Vitamin B6, pyridoxine. Toxicity, the supplement causing the problem, it's supposed to fix. Let me tell you about Gerald, 69. Gerald came to me with severe sensory neuropathy, burning pain in his feet and hands, loss of balance. He'd been diagnosed with idiopathic neuropathy 3 years earlier. Despite trying gabapentin, pregabalin, and multiple other medications, his symptoms had only worsened. His blood work was unremarkable. His EMG showed sensory neuropathy. His doctors were stumped. "Dr. Anderson," he said, pulling out a bag of supplements, "I've been taking all these vitamins and supplements to try to help my nerves. Nothing works. I'm spending hundreds of dollars a month, and I'm getting worse." I looked through his supplement bag. There were at least 8 different bottles, and when I checked the labels, 5 of them contained vitamin B6, his multivitamin, his B complex, his nerve support formula, his energy supplement, his stress formula. I calculated the total daily B6 intake. He was taking approximately 180 milligrams of vitamin B6 every single day. There was the problem. Vitamin B6, pyridoxine, is essential for nerve health. In normal doses, around 2.5 mg daily, it supports neurotransmitter synthesis and nerve function. But in high doses, typically above 50 mg daily for prolonged periods, vitamin B6 becomes neurotoxic. It causes the exact problem it's supposed to prevent: peripheral neuropathy. The mechanism is dorsal root ganglion toxicity. B6 in excessive amounts damages the sensory nerve cell bodies in your dorsal root ganglia, the clusters of nerve cells along your spine that process sensory information from your body. This causes severe sensory neuropathy, burning pain, numbness, loss of balance, difficulty walking. And here's the cruelest irony: vitamin B6 toxicity causes peripheral neuropathy, so patients take more nerve support supplements that contain even more B6, making the problem worse. A study published in Neurology found that pyridoxine-induced neuropathy is far more common than previously recognized, with toxicity possible at doses as low as 50 mg daily with chronic use. The neuropathy can be severe and partially irreversible if exposure continues for years. I had Gerald immediately stop all supplements containing vitamin B6. I checked his serum B6 level. It was 287 ng/ml. Normal range is 550 ng/ml. His blood level was nearly 6 times the upper limit of normal. Within 4 weeks of stopping all B6 supplementation, Gerald noticed the burning pain beginning to ease. Within 8 weeks, his balance improved. Within 6 months, about 70% of his symptoms had resolved. 3 years of worsening neuropathy caused by the very supplements he was taking to help his nerves. "I can't believe vitamin B6 did this," he said, stunned. "Every nerve health supplement on the shelf contains huge doses of B6. Nobody ever told me it could be toxic." Why does this happen? Because vitamin B6 in excessive doses overwhelms normal nerve metabolism and causes direct toxicity to sensory neurons. The damage is dose-dependent and duration-dependent. The longer you take high doses, the worse the damage becomes. And the damage can be partially permanent if exposure continues for years. Why don't doctors check for this? Because vitamin toxicity isn't on most doctors' radar. Vitamins are seen as safe. Supplements are natural. When a patient presents with neuropathy, doctors check for deficiencies, not toxicities. Serum B6 levels aren't routinely checked, and patients don't think to mention over-the-counter supplements when doctors ask about medications. If you're taking any supplement labeled nerve support, energy formula, B complex, or multivitamins, check the label right now. Add up the total vitamin B6, pyridoxine you're getting from all sources. If it's more than 10 mg daily, you are at risk for toxicity. If it's more than 50 mg daily, you are very likely causing nerve damage. We arrive at the 5th reason: hidden poison. Number 5. Chronic alcohol consumption. Even moderate levels can destroy nerves after 60. Let me tell you about Robert, 71. Robert came to my clinic with classic alcoholic neuropathy, numbness and burning pain starting in his feet, progressing up his legs, weakness, difficulty walking. His primary care doctor had asked about alcohol use. Robert had been honest. He drank 2 to 3 glasses of wine every evening. His doctor had nodded and said, "That's probably contributing, but that's moderate drinking. The real issue is probably your age and maybe some diabetes." Robert's HbA1c was 5.8, pre-diabetic range but not diabetic. His B12 and folate were normal. His liver enzymes were slightly elevated but not dramatically. "Dr. Anderson," he said, "I'm not an alcoholic. I have a couple glasses of wine with dinner. I've done that for 30 years. Why would it suddenly cause neuropathy now?" That's exactly the question. Here's what's happening at the metabolic level and why alcohol becomes more neurotoxic as you age. Alcohol is directly toxic to peripheral nerves through multiple mechanisms. It causes oxidative stress. It depletes essential B vitamins, especially thiamine, B1, folate, and B12, even if your blood levels appear normal. It damages mitochondria. It disrupts nerve cell membrane integrity. It causes inflammation. But here's the critical part. Your ability to metabolize and detoxify alcohol declines significantly after age 60. Your liver produces less alcohol dehydrogenase, the enzyme that breaks down alcohol. Your kidney function declines, reducing your ability to excrete toxic metabolites. Your body composition changes, less muscle mass, more fat tissue, which alters how alcohol distributes in your body, and your nervous system becomes more vulnerable to toxic insults because nerve regeneration capacity declines with age. What was moderate drinking in your 40s and 50s can become neurotoxic in your 60s and 70s, not because you're drinking more, but because your body can't handle it the same way anymore. Research published in the Journal of the Peripheral Nervous System found that alcohol consumption of even 2 drinks daily in adults over 65 significantly increases the risk of peripheral neuropathy, especially in the presence of other risk factors like prediabetes or nutritional deficiencies. I had Robert do something radical, complete alcohol cessation for 3 months, along with aggressive nutritional support, thiamine, B1, 300 milliliters daily, absolutely critical for nerve function and often severely depleted in chronic drinkers, methylated B complex, to restore all B vitamin levels, alpha-lipoic acid, 600 milliliters daily, for antioxidant support and nerve regeneration, acetyl L-carnitine, 1500 milliliters daily, for mitochondrial support, magnesium glycinate, 400 milliliters daily. Robert was skeptical. He didn't think he had a drinking problem, but he agreed to try. The first 2 weeks were difficult, mild withdrawal symptoms, trouble sleeping, irritability. By week 3, he noticed the burning pain in his feet was less intense. By week 6, the numbness had stopped progressing. By 3 months, he had regained significant sensation in his feet, and his walking had improved dramatically. I didn't realize how much the wine was affecting me, he admitted. I thought 2 glasses a night was nothing. I had no idea it was poisoning my nerves. He's now been alcohol-free for 2 years. His neuropathy has stabilized. Some damage was permanent, but the progression stopped completely when he stopped drinking. Why does this work? I'm Dr. Robert Anderson. Fix the causes. Reclaim your sensation. Restore your strength. I'll see you in the next video.